Before we get started, I want to give a special happy birthday shout out to Martin Green. Martin will probably be the first to download and listen to this episode. So Martin, I hope you have a great day, and I hope you enjoyed the episode. The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. And by the Change Execution Group. Visit 360lifetransformations.com. Before we get into today's show, I want to invite you to connect with the Healthcare Security Cast on a new platform. It's a text-based platform called Community. To join, all you have to do is text my community number, and that number is 647-372-2042. That number again is 647-372-2042.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Tuesday, October the 20th. Today I'm joined by Jean Eaton. Jean, thanks for joining us today.
I'm delighted to be here, Brian. Thank you.
And we always like to start off by getting to know our guest. So I will ask you the kind of loaded question. Who is Jean Eaton?
Well, Jean Eaton is currently in Edmonton, Alberta, although I like traveling all over Canada. So I'm a certified health information management professional, which means that I'm a chimp. And as a chimp, I have been a director of health records across hospitals across Canada. In my volunteer life, I've got over 20 years experience working as volunteer medical first responder in communities across Canada, and the favorite human to my canine walking coach.
Very good. Now, you touched on this a little bit with just some of what you said, but can you walk us through your career path and let us know what led to the work that you do today?
Sure. So I'm a certified health information management professional, formerly known as health records administrators. So I've been a director in hospitals across Canada. I like working in remote northern locations. So I've worked in Baffin Regional Hospital in Iqaluit and Kirkland Lake Hospital. I've done independent consulting to communities in the far north on the James Bay coast. I've worked in BC and Alberta and so on. But now my practice is really focused on independent healthcare providers. So my passion is to help these entrepreneurs, these business people who are trying to develop their healthcare practices to help make sure that they have good business practices, that they have good privacy compliance requirements, and that I can help them to grow their careers and their practice at that grassroots, mom and pop kind of position or healthcare practices.
Excellent. And you did touch on one thing there that I do want to get into. It's just the emphasis that gets placed on privacy and security of information in the healthcare environment. Mm-hmm. So for the context, what would you say is the difference between privacy, confidentiality, and security?
It's a good question because it gets a little blurry sometimes. So privacy is an individual's right to decide what of their personal information that they want to share with other people, what they want to keep controlled to themselves or secret, if you will. And they have the right to decide who they want to share that information with. So privacy is very individual based. It's your right to decide how you're going to collect, share, and use your personal information. Confidentiality is our job. When we collect patients' information, it's our job to keep it secret, if you will. So it is only used when you have a need to access that information to provide the service that for the purpose that you collected it. So if a patient comes to a hospital, they're providing their personal information because they want healthcare services. And they allow the doctor or the hospital to bill for that service so that they can get compensated and other reasonable uses of that information. For example, getting a lab test requisition so then get the lab test results. When we look up patients' information, if we don't have a need to know that information, that is a breach of confidentiality. So confidentiality means that we respect that individual's right to privacy and only look at it when we have a need to do that for our job for the purpose that we collected the information. Security are those things that we put into place to make it easier for us to make sure that we're respecting the privacy and confidentiality of that information so that nobody has access to the information when they don't have a need to know it to provide for their business use. So privacy is an individual's right. Confidentiality is our job to make sure that we respect that privacy of the individual. And then security is our checks and balances to put into place to make sure that we've got good safeguards around that individual's information to make it safe and secure and only used for the intended purposes.
Excellent. Now, another thing that I kind of want to dive into, just and you started in that direction already, is basically, just to get an idea of who has access to health information. You kind of already covered that, and also what type of information can be provided to security personnel. So that's the part that's going to be of interest to our listeners who are primarily healthcare security leaders.
Right.
And in what scenarios would they have access to said information?
Okay. So health information can be a lot of information, but it can also be a very little bit of information. So generally speaking, any three pieces of information that we uniquely identify an individual and the reason why they've collected that information to provide that health service is considered health information. So unique identifying information would be certainly your name, your address, and your date of birth. It might be your insurance healthcare number. It might be a chart number. And it might be your diagnosis and your admission date and all of that other stuff that is associated with that individual's visit to the healthcare provider. So health information can be a very big set, but remember, it only takes three pieces of information to uniquely identify that individual. And when that information is within that context of a hospital visit or a healthcare visit, then it becomes even more important or more sensitive so that we don't share that information inappropriately. The other thing that's really important to remember is that what you might consider as being confidential information or private to you might be something different than what I might consider. So we all know you should never ask a woman's age, right? You should never ask their weight. So it doesn't have to be something that we would consider really sensitive, maybe a diagnosis or a blood type result or a test result, for it to be considered health information. So we often get tripped up because the innocuous information about having a name associated with a healthcare visit and their email address constitutes health information. So it becomes really easy to unintentionally leak health information because we don't think that these little things become health information. So as a healthcare or security leader in a healthcare organization, you have access to health information every day that you're in the organization. You might see something. You might see Mrs. Jones coming into the emergency room. Because Mrs. Jones is in that emergency room on that night, that becomes health information. So it doesn't even have to be something that is written. You might overhear a conversation. And in fact, we have a lot of privacy breaches because people are chatting when they're in the elevator. That's a privacy breach. It's not in writing, but you've breached the privacy of those individuals. So just because you are working in the four walls of a healthcare organization, a hospital, you're going to have access to a lot of health information just because of the vicinity of where you're at. As a security professional working in a hospital, you might also have legitimate access to health information to do your job. Perhaps there is a register about people logging in or logging out, or maybe you're looking after the swipe cards that staff will have about when they log into work or they have access to restricted access to different parts in the hospital. So those are pieces of health information that you may have as well. You also get to see and have access to restricted areas. So there is a lot of information that is written. It might be on a fax machine. It might be sitting on a photocopier. It might be information in a garbage can, which really should be in shredding information. Patients bring health information to the hospital on a regular basis. They bring a copy of their letter from their family doctor so they can give it to the emergency room doctor, or they have their identification, their healthcare insurance cards. All of that stuff is health information. And we have to be really clear about what data we collect, because when you know what data you have, then you can protect it. If you don't know what type of data set of information that you have, then we don't protect it really well because we didn't know it was there and we don't have good safeguards in place. So as a security guard in a hospital, you might have legitimate and appropriate access to health information. And then there is a whole bunch of other incidental health information that you might have because of the nature of the job or just the location where you happen to be.
Excellent. Now, another piece that relates to security as well, and I know a lot of my peers have had challenges with this, and that's sharing information with law enforcement when there are specific issues with certain patients. And that, that's something that's been a challenge for policy reasons.
Mm-hmm.
What are some best practices that you could share for just for sharing health information with law enforcement agencies?
Sure. And this happens all the time when you work in the health records department too. You get the police officer coming down and they, starting to demand information. So there are a couple of guiding principles that will help you to make a decision about what you might be able to do in different circumstances. So it's the least amount of information needed on a need to know basis. And it is very contextual. So three scenarios that you might consider as far as a security guard. So you might have a police officer coming to the security desk or on your rounds and say, hey, can you tell me if Mrs. Jones has been admitted to the hospital? And that might be information that you know, but if it's not part of your job to release that information, then the best way that you can be helpful to that person is to refer them to that individual that's going to help them because it is part of their job. You don't want to release information about Mrs. Jones and which room that she's in because you don't know if she has specifically requested that information not to be shared. So the best way that you can be helpful is to refer that person to the administration desk or registration or nurse in charge or whoever's appropriate for that circumstance. There might also be an example where there is some urgency. So a police officer might come to the security guard and said, have you seen Mr. Jones tonight? We have reason to believe that he has a knife with him and may be harming himself or somebody else. So that level of urgency about locating Mr. Jones has just escalated considerably. So there is some discretion about what an individual can disclose, and a risk to the individual or somebody else kind of goes to that top of that list. So even if you know that Mr. Jones might have been seen in the emergency room or you saw him going down to the cafeteria, you might want to share that information with the security officer because there is that level of urgency. But you would only provide the information that's needed for that context. I saw Mr. Jones going to the cafeteria. Let me escort you and we'll find Mr. Jones and look after the scenario. It's not the same as saying, oh, Mr. Jones, that's the guy that was here a couple of months ago and his wife did this and that was the scenario and that was, you don't need all that background. You're just dealing with the situation at the moment. Mr. Jones is a risk or might be at risk himself. This is what we need to do to address that concern right now. Another scenario might be that a police officer would come in and talk with the security and say, were you here a couple of weeks ago when we brought Mr. Jones into the emergency room? Well, I'm just following up on that situation now. There might be charges pending, and I need a copy of that security incident report. Can you get that for me? Well, there isn't an immediate need. So you need to go through your routine process about what you can and cannot disclose. So ideally, you will have some SOP, standard operating procedures, about what you can and not disclose in different scenarios. So depending on your SOP for your organization, you may be able to release that security incident report or access that health information on your own authority because that's part of your role and you've been authorized to do that. Or it may be, sure, I can help you with that. Give me your written request. It might require a subpoena. It might be authorized by the individual. It might not. And it might or might not be your role to release that information. but you still have a duty to assist. You want to be helpful. You collect all the necessary information so that the right person can make the right decision at the right time.
Excellent. Now, as far as it concerns the healthcare security professional, what what can they do to take an active role in the healthcare environment in privacy and confidentiality?
I think that you have got a fantastic opportunity to be a real advocate for privacy and security in your organization. So, as a security guard at a healthcare organization, you are inside the building, you're outside the building, you're in places where most people don't get to see. You have a great opportunity to observe and to be able to help enforce good privacy practices. So when I mentioned, that nattering back and forth in the elevator, um, that's a great opportunity to be able to say, excuse me, I'm not sure that that information should be shared in that public elevator, right? So you need to have that culture and that leadership to be able to really reinforce that we want to respect patients and employees' privacy and make sure that we've got these good rules to follow. Then it makes it easier for that person, that security professional, to be able to remind people nicely that they shouldn't have these conversations in the public cafeteria or the elevator. While you are observing in the emergency room or in the nursing wards and you see health information that's in the garbage and it really should be in the shredder, that's a great opportunity to provide that training moment, grabbing that information from the garbage, giving it to the nurse in charge or whoever's in that piece of authority, or maybe you give it to your supervisor so that you can provide that appropriate training piece afterwards to say, I found this in the garbage at such and such a time, such and such a place. It would be better done if it was done in shredding. Let's take a look about why that didn't happen and make sure that it happens correctly the next time. So there are lots of opportunities like that to be really good advocates. Patients are also a really good opportunity to leak privacy. And one of the examples that is really telling is many hospitals have a pharmacy department, and maybe that's just for inpatients, maybe it's for outpatients, or a mix of both. But one of the most frequent sources of a privacy breach around prescriptions is the patients themselves. They go to the pharmacy, they get their medications, they've got this piece of paper that's with them that has the name, address, date of birth, the prescription number, and all that other wonderful stuff that tells them how to take it. And they just trash that in the garbage or they drop it on the way to the car. And that piece of information is used for medical identity theft every which way from Sunday. It's a high price, high value commodity. So being able to be observant for those type of activities is, I think, a great opportunity for security personnel. Another thing that I think is really important is each organization needs to have a security and privacy breach incident response plan. And the skills for the healthcare security professional is fantastic to be able to share as part of that incident response plan. So if there is a privacy or security breach, there needs to be an investigation. And depending on the type of the breach, it might be a different type of investigation. And that sounds to me like a great opportunity for the security professional to share their skills about how to do a good investigation and to be able to provide that other point of view to contribute to that investigation. Now, in each organization, there should be training for that incident response team. And I would suggest that your security team should be a member on that committee, be part of that training so that you can receive training about how to best respond to that incident and what your expectations are. And then you can be a very valuable contributor to that privacy and security incident response plan to make it better to preserve privacy for everybody.
Excellent. Now, the thing that we're going to talk about now, and it's kind of the heart of this discussion, is employee snooping.
Mm-hmm.
Now, I'm sure employee snooping is exactly what it sounds like, but would you mind defining employee snooping and sharing some examples of what constitutes that?
Sure thing. So employee snooping is when an employee is looking at patients' private information for a purpose that is not authorized to do their job. So it's that person that is looking through the EMR system or the admission systems or the billing systems or the prescription systems, or just looking through paper records because they're curious. They want to know. They have access to it. It's not part of their jobs, but they want to look up that information. So maybe it's their own information. So we can't look up our own information because you're not providing a health service to yourself. So when an individual looks up their own information or information about friends or family, or maybe it's a VIP, or maybe it's that really cute girl that works down in the pharmacy department, when you look up information that's not required to do your job, that's snooping. And it is a privacy breach. And it is actionable as far as sanctions under your organization, and in many jurisdictions under professional conduct and under privacy legislation.
Excellent. And yeah, there's been a lot of examples of that, not necessarily recently in the news, but there have been a few over time. I can think of well, you mentioned VIPs, some very high profile individuals who were either getting treatment or passed away in hospital, unfortunately.
Mhm.
And as a result, you see a rash of employees getting terminated after the fact because they had violated privacy there.
Absolutely.
And also the other example that you gave was one that I've seen, I've seen working in a frontline security role, or actually in leadership roles as well, where an employee accesses either their own or information of a family member. Definitely a really relevant topic. Now, what are some of the things that we can do to prevent employee snooping?
Well, I like to talk about the 5 steps that you can do to prevent employee snooping. And the first thing is to be a privacy champion. So, as an individual working in a healthcare organization, you can be a champion for privacy. And that means just, making sure that you are being observant, that you are taking a step. I know that security likes to say that if you see something, say something. It applies to privacy breaches as well. And it applies to how we monitor individuals about snooping. So it is far better to identify somebody who is snooping at the time that it happens rather than 3 years later when somebody finally, kind of fesses up or brings that situation to the supervisor for follow up. So being a privacy champion is the first big step. Each organization must identify a privacy officer for that organization. And sometimes the terms are privacy officer, a risk management officer, a compliance officer. It is that person that is responsible for ensuring on behalf of the healthcare providers and the organization that there are good policies and procedures and monitoring and systems in place to protect the privacy of individuals. So a privacy champion can be an individual employee and hopefully many employees in a healthcare organization, but there probably should also be 1 or 2 or more individuals assigned that role as a privacy officer in the organization. Somebody who has a very specific role to do to make sure that privacy is being managed. Now, we know that if nobody is assigned that role, everybody assumes that someone else is going to do it, right? So if there is a privacy or security incident, we don't have to worry about it because somebody over there is going to look after it. When you name somebody, they become accountable for it. And just by naming somebody to be accountable for privacy in your organization drastically reduces, maybe up to 50% by some reports, the likelihood of having a crippling privacy and security incident in your organization. So just being a privacy champion is a fantastic first step. The second step is to be able to identify training opportunities. So we need to know what privacy awareness is. We need to know the definitions of privacy, confidentiality, and security. And even if you can't repeat it back to me verbatim, knowing that individuals have the right to privacy and that you are not allowed to look up patients' information unless it's part of your job are key steps that everybody needs to learn. So everybody in the organization should be receiving privacy awareness training. And that means the new employee, that new grad that just graduated from pharmacy or physiotherapy or whatever discipline. It also means that employee that's been working in the system for 20 years and has just now joined your organization. It also includes those individuals that don't have a particular role that have to do with healthcare. Maybe they're part of kitchen help or bookkeeping. They still need to go through that privacy awareness training because we all need to know so that we can do something about it. But from the organization's point of view, we want to make sure that everybody has a common understanding about what is expected in their roles to protect privacy and security in the organization and how it relates to their policies, procedures, and who do you report it to in your organization. So the level of training may be different between a healthcare provider or a nurse in charge or somebody who's working in the kitchen, but they all need to have that privacy awareness training. So we need to do it at orientation. We also need to do it throughout the year. Now, I'm going to tell you that privacy can be fun. So make privacy awareness training fun. You can do quizzes and contests and posters and funny memes, but reminders throughout the year will keep it top of mind, keep people talking about it, remind them that they're not supposed to have that confidential conversation in the elevator, and we can all do a better job. So the first step is to be a privacy champion. The second step is to do your training. The third step is to make sure that we've got some reasonable safeguards in place. So we talk about safeguards in 3 types of categories: administrative, technical, and physical. So administrative safeguards are the types of things that we put in writing, like making sure that everyone that attends privacy awareness training. It might also be oaths of confidentiality or posters on the wall saying, we respect privacy, and if you've got any questions, contact our privacy officer here. Technical safeguards these days often refers to computer networks, but not just exclusively computer networks. So technical safeguard might be making sure that everyone has a unique user ID and password to log into the system. Also that we have restricted access to physical spaces and that there might be swipe cards or keys given to employees, and that there is a good system to make sure that those keys can't be duplicated, that they're accounted for on a regular basis, and when those employees leave the organization, that those keys are recovered. So that often is a role of the security professional in your organization. So those might be roles that you're familiar with. Your technical safeguards includes having unique user ID and role-based access to the computers. So if you are somebody working in the kitchen, you might need to have access to the admission records in the hospital system so you know where you're delivering the meals, but you don't need to know the operative reports and the prescriptions because that's not part of your job. So that's role-based access. It also applies to security cameras, your telephone systems, the internal paging systems. All of that sort of thing kind of falls under the category of technical safeguards. Physical safeguards would include those things that you can touch and feel, so that you've got locks on the doors, you've got key code access, that you change the defaults on those push button locks on doors. Otherwise, everybody knows that the number is 1534, right? It's factory set default. Make sure you're changing those types of defaults. So there are reasonable safeguards that we need to implement. There are lots of things that we know happen. So take the stuff that we've learned from other people about bad things happening and finding the right solutions to prevent those bad things happening again in your organization. The fourth step is to be able to do some monitoring. So we want to know that people are doing the right things. And I don't want to say that Big Brother is watching, but somebody better be watching. So we want to be able to monitor individuals to make sure that they're doing the right things. And that will help to identify when people are doing the wrong things. So we do that by observation. Your supervisors, your employees and coworkers, make sure that people know that if they see something that doesn't look right, then they should be saying something. And we want to be able to prevent snooping by monitoring. And quite frankly, if an individual is inclined to take a look over there because nobody is watching and nobody ever gets in trouble, then we can demonstrate that if we have good monitoring systems in place, that it really does curtail snooping activities. Now, some of these activities might be really simple. It is doing a walk around and doing an inspection and seeing all the good things that you're doing and things that need improvement. Sometimes we can add some technology in our audit logs and artificial intelligence to be able to monitor user activity, to look at those unusual circumstances. Our warning messages when restricted access door is being used in off hours is another example about doing some monitoring. The fifth step is that we need consequences. So if the first four steps haven't happened, or there is a noob, or there is an external bad actor, and there has been something that has gone wrong, there needs to be some consequences. So we're talking specifically about snooping. Employees should know that snooping is not acceptable. And we're finding more and more cases where that message is being heard very strongly. So within your organization, there should be some sanctions and some discipline policies. Now, this is not the same thing as I sent a fax to the wrong person. It was my mistake. I looked up Mrs. Jones' record when I should have looked up Mr. Jones' record. Those are errors, mistakes. And while that shouldn't happen regularly, we are human and we will make mistakes. But if an employee is looking up their record or their family's record or their spouse's record or their, the VIP, that is not an oops, that is snooping, and it is not acceptable. It is a privacy breach. So your organization should have appropriate sanctions and discipline in place and a whistleblower protection policy so that when that somebody sees something and says something, that they're not going to have any blowback on them because they called out somebody doing something inappropriate. There are some other consequences that I want to provide as far as examples, Bryn, about discipline and what's happening in legislation. But I want to stop for a moment and let you ask me some questions about those 5 steps to prevent employee snooping.
No, it's funny. That's actually kind of where I was going to go with it, is some of the consequences.
Okay.
So actually your segue was just perfect for the question that I had.
Okay. So in many jurisdictions across Canada, there are provincial privacy legislation that covers the events of snooping. And in some jurisdictions, there have been charges and convictions under the provincial privacy legislation. And each province is a little bit different about how that comes to pass and what type of charges can actually be laid. However, I can give you some examples recently from Alberta, which probably has one of the most robust privacy legislation under the Health Information Act. So for snooping, we've had 5 examples this year that have gone to court where an individual and a receptionist at a clinic, somebody who works as doing billing for a physician's office, somebody who has worked in laboratory reception and has access to laboratory data. There have been examples where each of those individuals were found suspicious of snooping, that their information was reported to the Office of the Information and Privacy Commissioner. They did an investigation and determined that there were enough evidence to substantiate charges being given to the Special Prosecutions Branch, and then the Crown would then lay the charges under the Health Information Act. So now they've had their day in court, and the types of consequences that we're seeing is that there are fines. Fines have been handed out to individuals that ranging from $1,000 to, in one case, $10,000 from the court. They have been fined under the Health Information Act. Some individuals have had probation sentences that they've had up to 180 hours of community service. And many of those individuals have been banned from working in an environment where they would have continued access to health information. So the court can't fire the employees, but they can say you can no longer work in an organization that has health information. Also from the courts, there have actually been cases where counseling has been ordered from the bench. Now, in an organization, there may be consequences, including and up to being fired. Charges may be laid or complaints laid under their professional colleges. So people have lost their license to practice for a period of time. And because they've had tribunals in their professional colleges, many people have been ordered to pay associated court costs or tribunal costs. So while the fine of, say, $10,000 may not sound like a lot, they've also had to pay all the legal costs associated with that. And we know that that can add up really quickly. There have been some suspended sentences and probationary sentences from the court. So potentially, if they didn't meet the requirements from the bench, then they could be fined and actually find themselves in jail.
Obviously very stiff penalties. So
Absolutely. And we're going to see a lot more of the same.
right now, I also want to throw out a scenario here. So a healthcare facility experiences a privacy breach.
Mhm.
How might the security professionals be involved in the privacy breach incident management?
Well, I would love to see more security professionals part of that incident response team for a number of reasons. One, you've got some additional training that the administrative people like me and health records don't have. And you've always got some security professionals on site 24/7 in just about every organization. So you've got that opportunity of immediacy to be able to start the investigation right away. Depending on the nature of the breach, you might have a more active involvement in doing the investigation. So if an employee is suspected of doing something that they shouldn't have, there might need to be an interview with that employee. And that maybe is better conducted by security professionals. There might need to be, a hunt and search. If you've lost a hard drive somewhere, there might actually need to be a search that needs to happen. So I think there are lots of different ways that a security professional could be involved, and it might be very specific for that particular incident. But I would love to see more security professionals involved and taking an active and a proactive role on that incident response team. I think you've got a lot of skills to be able to offer. And I would invite you to find your privacy officer in your organization and see where there's an opportunity for you.
Yeah, and you touched on something that I was thinking too. There's the skill set that we come with is something that'd be very beneficial in that type of response.
Absolutely.
Now, we did cover a lot of topics, and I think there's a lot of value here for security leaders. Is there anything I've yet to mention that you'd like to discuss?
I think that there is a lot of value for security leaders to be very proactive and to take a positive role in your organization to be able to encourage being a privacy champion. So there are lots of good things that we can be doing to help patients and help employees better understand their opportunities for privacy and security. And I think that's a great role for security leaders in healthcare to take an active role in and take something proactive and really run with it and make it work in your organization.
Excellent. Now, there is another resource that we haven't touched on yet that a lot of security leaders, I think, and just healthcare leaders in general or leaders in general would find valuable, and that's your podcast.
Yes.
Can you talk to us about your podcast and anything else that you're working on that we should be watching for?
Sure thing. So I host a podcast called Practice Management Nuggets, and we talk about tips, tools, templates, and training to help you with practice management and being privacy compliant. And I also interview guest experts that help to support those organizations to do that. So the podcast can be found on practicemanagementnuggets.live, and you can download it as a podcast, or there are videos on YouTube as well. So that's a great resource. I would love to have you listen in on some of our podcasts about privacy and security compliance. We also have a tip sheet that you can download. So for our conversation today, Bren, you can download the 5 steps to prevent employee snooping. So you go to our website, informationmanagers.ca /5 steps to prevent snooping. So I'll give you the link and you can share it with your audience.
Awesome. As we're kind of wrapping up here, obviously this has been a very challenging time for healthcare leaders. Do you have a special message for the healthcare security cast community?
I think the saying about if you see something, say something, applies to privacy and security as well. So it's something that we can empower individuals on your security teams, your employees, and individual patients to be able to take a very proactive role in being responsible for and contributing to the privacy of health information.
Excellent. And in closing, what is the best way to connect with you?
Love to have you come and join me on the podcast, our website, informationmanagers.ca. And I'm frequently on LinkedIn and Twitter and a little bit on Facebook, on Instagram. So join me on social media.
Excellent. Well, thank you so much for your time, Jean. I appreciate it. And there's a lot of value in this conversation. So thank you for that.
Thank you, Bryn.
And this concludes another episode of the Healthcare Security Cast. Thank you for joining us. Join us again next week when we have a new guest and a new topic. In the meantime, connect with the Healthcare Security Cast on social media. Follow the Healthcare Security Cast page on LinkedIn. Join the Healthcare Security Cast community on LinkedIn. Join the Healthcare Security Cast community on Facebook and follow our page on there as well. Follow the Healthcare Security Cast on Instagram and Twitter, where our handle is @HCSecurityCast. And then the easiest way to stay connected, receive updates, hear about upcoming giveaways and events, is to join our text community by texting 647-372-2042. That's 647-372-2042. Until next time, stay safe and take care.